Dr. Jinal Bhiman from the NICD, you're a principal medical scientist, and as this headline of COVID-19 variants have hit us today, what is the B1.1.529 lineage variant?
So this lineage is a new variant that we've detected in South Africa. And what classifies it as a new variant is that it's acquired a significant number of mutations. And it is actually quite different from what's circulating in South Africa in our third wave. As you know, that was characterized by the Delta variant. And so, it's very different. That's what's really raised the warning flag for us at this point.
How do the C1.2 beta or delta variants differ from the B1.1.529 lineage?
So there is a lot of overlap in most of the SARS-CoV-2 variants, but this variant is actually the most shocking one I've seen. It's got far more mutations than we've seen before, and these mutations are concentrated in functional regions within the spike gene. And the spike gene, you may know, is part of the virus that actually is used to enter our cells. So if there's a lot of mutations happening in that region, it's quite worrying. It's also the part of the virus that when you get vaccinated, your body makes an immune response to. So if this part of the virus is changing, it is worrying for us because it makes us concerned that maybe our vaccines might not be as effective.
Wow. How effective are the vaccines then against new variants?
So as you know, they're not very effective against protecting from infection, but all our variants globally and in South Africa has shown that they are very effective against protecting from hospitalization and from protecting from death. With this, obviously, it's early days, so it remains to be seen. We're hopeful that this is going to continue, and a lot of these predictions come from analysis of certain parts of the spike gene. So as I mentioned to you, antibodies are one arm of the immune system. The other arm of the immune system is the T cell response. And so luckily for us, T cells are much less fussy than antibodies. So it looks like there are a couple of T cell, what we call escape mutations in this variant, but there are also quite a number that are conserved and that are remaining the same. So we hope that if antibodies are not doing as good a job, at least the T cells will cover us.
And I guess time and research and science will, of course, give us that information as we identify this more and more. If you have been infected with the previous variant of COVID-19, how immune are you to this new variant?
So this is now based on an analysis of the reinfections that we're seeing. And then also contributing to this is some modeling data based on this variant, how many changes it has, and how quickly we've seen the increase in the number of cases in Gauteng, for example. But it looks like reinfection with this variant is going to be very high, regardless of which variant you were previously infected with. So even if you had infected with the Delta variant in the third wave, it's looking like reinfection is a very, very likely possibility.
Okay, thank you so much for that. Information also predicts that the new B1.1.529 variant is more transmissible and immune evasive. Is there any more clarity on this?
So this is all predictions. There's no scientific data on this as yet. We literally released the first sequences on Monday for this genome. So science doesn't happen in a week. So we're still doing, it's going to take a little bit of time for us to have a handle on how transmissible, how much more transmissible, and what the level of immune evasion is. But the information we know is all based off predictions.
You know, in South Africa, we're very used to adapting as things continue. And with this news that has now hit, I mean, we heard the minister's briefing, we're working with the NICD to really, keep people abreast with the information. But the reality is there's always the mind that runs away with you, increasing one's anxiety, uncertainty. We're into the December period. What would your advice be to those out there to calm down, because you as scientists are on this?
So I think if you've been vaccinated, you at least know you have some kind of immune response against this virus. And so I think, fortunately, it's not a generalizable statement. Every person needs to weigh their risks, and it depends on your own health. It depends on the people that you live with. It depends on the people you interact with. My advice would be to people with comorbidities, to our older folk, to be a little more cautious, to start tightening up on your COVID protocol again, wearing your mask and making sure that you're going to places where people are wearing their masks. That would be my advice. I think it's a difficult one to balance at this point because everyone is really tired of this virus and tired of everything it's been restricting us from doing. But I think, the government can only protect us in as far as they have to also balance out the economy and things like that. So now I think 2 years in, need to take some of this responsibility in our own hands and also kind of lay out the risks for ourselves. And it's going to be different for each person. But yeah, my people who are at most risk are obviously people who are unvaccinated and people who are older and have comorbidities.
I know that you're burning the midnight oil with the NICD and your fellow scientists and experts over there. What are you hoping to see with the data and the research that you're currently busy with? Because this is literally immediacy of data, input, results, and of course, feedback.
I think we're hoping to see that vaccines are going to be protective against disease outcome, hospitalization, and death. I think that for us, if we see that, we'll be happy. We'll be so relieved. But we're holding our breath. We'll see what the data shows us.
Fantastic. Dr. Jinal Bhiman, thank you so much for your time, for joining us. Good luck with all the data, the research and information. We're holding thumbs. We got your back, and we look forward to chatting to you soon to keep people abreast with the expert and credible information whenever we can. Thank you for joining us.